Welcome to the Sunshine Nutraceuticals podcast with your host, pharmacist Michael, where you learn everything about happy, healthy living. Now, here's your host, pharmacist Michael.
One of the most popular questions I get on my TikTok live stream is how to get rid of heartburn. Like most medical conditions, the best treatment is prevention. Keep track of what you eat before heartburn strikes and try to eliminate that food from your diet. Avoid large meals and greasy foods. If you find yourself suffering from heartburn, the first treatment should be an antacid. Tums or Rolaids neutralize stomach acid and can start working in seconds. You may also try Maalox if you prefer a liquid, although some people are not too fond of the chalky texture. Typical antacids start to work in as little as 3 minutes and can last for up to 3 hours. Because of this, you may wake up during the night with stomach pain. Remember, sleep is one of our 5 pillars of health. You want to make sure that you get a good night's sleep. Antacids may cause constipation or diarrhea, depending on the product used. The next step up is what we call the H2 blockers. These medications stop the cells in the stomach that produce acid from responding to histamine. This results in less acid being secreted into the stomach. Less acid in the stomach decreases heartburn. H2 blockers can begin to work in as little as 30 minutes, and the effects can last for up to 12 hours. These drugs may cause constipation, diarrhea, headache, nausea, and/or vomiting. Some examples of H2 blockers are famotidine or Pepsid, nizatidine or Axid, and cimetidine or Tagamet. The last group of medications I want to talk about are the proton pump inhibitors or PPIs. PPIs are used to prevent frequent heartburn. They often will work better than the H2 blockers. You can get PPIs over the counter, but they are also available by prescription. We often use these medications for Barrett's esophagus and GI reflux. Some side effects that can be caused by PPIs are nausea and vomiting, headache, stomach pain, and diarrhea. One of the biggest worries when taking PPIs is your increased risk of infection. Because stomach acid is our first defense against oral bacteria, if we neutralize that acid with a proton pump inhibitor, that gives the bacteria a better chance to survive the stomach. Some examples of PPIs are Protonix or pantoprazole, Nexium or esomeprazole, Prevacid or lansoprazole, and Prilosec or omeprazole. Constipation is a condition in which our bowel movements are less frequent and stools become hard to pass. Did you know that around 2.5 million people see the doctor each year with a complaint of constipation? The incidence of constipation increases as we age because older people are generally not as active, have a slower metabolism, and the muscles in the digestive tract weaken with age. Other things that lead to constipation are not drinking enough water, not eating enough foods high in fiber, being female. Yes, ladies have an increased risk due to their hormones. Not getting enough exercise, stress, eating too many dairy products, and some medications. Medications such as narcotic pain medications, antidepressants, antacids, some blood pressure medications, mostly calcium channel blockers and beta blockers, anticonvulsants, Zofran, and some antipsychotics. How do we treat constipation? The first thing I will tell you is the same thing I told you for headaches in our last episode. Increase your fluid intake. Drink more water. Move more. Increase your exercise. Eat more high-fiber foods, whole grains, prunes, and other fruits and vegetables. Keep a food diary and pay attention to what foods you eat contribute to your constipation. What kind of medication should you take? Metamucil or Psyllium, Miralax, Citracel, or Benefiber is a good start. Add these to your morning routine. If this doesn't give you relief, add milk and magnesia. The next step is senna. This is a stimulant laxative, and so it may lead to stomach cramping. You may also use glycerin suppositories or a fleet enema. This is normally a last resort, but it can work very quickly. If these treatments are ineffective, see your physician. Constipation can at times be a symptom of a bigger problem. You should be seen if constipation lasts for more than 3 weeks, you have severe pain with bowel movements, unexplained weight loss, or blood in your stool. The last condition we're going to talk about is diarrhea. Diarrhea is a term used to describe loose, watery, frequent bowel movements. Diarrhea is a symptom that occurs when there's a disruption of the gastrointestinal system. Diarrhea can be caused by viral or bacterial infections, antibiotic use, or food poisoning. One of the most important things to remember when suffering from diarrhea is to stay hydrated. Drink plenty of water or sports drinks such as Gatorade. Alcohol, soda, milk, and drinks containing caffeine should be avoided. There are several treatments for diarrhea. The first is probiotics. Probiotics can help balance the bacterial flora in your gut. Diarrhea is caused when the bad bacteria overtakes the good bacteria in the GI tract. Probiotics can come from foods, which is always preferred. Some examples of probiotic-containing foods are yogurt, kefir, sauerkraut, kombucha, and kimchi. Sunshine Nutraceuticals has a premium product called Probiotic 40. This formula contains 4 strains of helpful gut bacteria that can not only help to treat diarrhea, but can also improve your general gut health and your immune system. You can order Probiotic 40 at www.sunshineNTC.com. There are some OTC medications used for diarrhea. These products only control symptoms of diarrhea. They do not treat the cause. 2 of these products are loperamide or Imodium and bismuth subsalicylate or Pepto-Bismol. What you eat when you have diarrhea is also important. When suffering from diarrhea, I strongly suggest sticking to the brat diet. This is bananas, rice, applesauce, and toast. These foods are generally better tolerated when diarrhea is present. You should see your doctor for diarrhea lasting more than a week, blood in the diarrhea, severe abdominal pain, or a fever that doesn't break. I hope you have enjoyed this episode of Sunshine Nutraceuticals. Please stay healthy, be happy, and send in your questions or comments. You can reach us at sunshine.nutraceuticals@yahoo.com. All comments will be read.
Thank you for listening to the Sunshine Nutraceuticals podcast. Visit us today at www.sunshineNTC.com. Have a happy, healthy life.